Hey, how's everyone doing today? Today, I wanted to talk about understanding ESRD Medicare, the qualifications and application process, special considerations for Medicare insurance agents and helping your beneficiaries, and some non-government programs to help your beneficiaries pay for their premiums. So today we're going to dive deep. My name is Joanna Wyckoff. I used to work for Social Security Administration for about 9.5 years. I used to take these applications myself and help the American public navigate a very complicated process because many people who qualify for ESRD, they are not 65, so they weren't planning on Medicare. Many of them did not apply for disability. They were suddenly put on dialysis. This is one of the qualifications that is new, different than regular disability. So let's go ahead. So the first thing is qualifying for ESRD Medicare, then applying for ESRD Medicare entitlement months, termination of Medicare entitlement, Medicare plan considerations, and non-government health insurance programs. Let's go forward. So the first qualification is end-stage renal disease is a condition of permanent kidney failure that requires regular dialysis or a kidney transplant. It's a critical health condition that necessitates specialized care and support. In order to qualify for ESRD Medicare, the beneficiary must be undergoing regular dialysis or have received a kidney transplant. Now, I have the Social Security policy ready to go for you guys. It is SSA POMS DI 45001, period 001, end-stage renal disease entitlement provisions. This is the policy that governs their entitlement. So if you copy and paste this into Google, you'll be able to come up and see it right away. Let me see if I can screen share it. So here's the policy. And the first requirement for entitlement is they have to be insured from Medicare. And it's not the 40 credits. They actually have to be insured based off of age and work credits. And this is the only time you'll see someone qualify in someone else's record, such as a spouse or a parent, without the disability requirement. So when I was working at Social Security, I actually had a 9-year-old child on dialysis, and that child qualified based off of her parents' work record. Social Security will do the entitlement process for you. You don't have to worry about this, but it's possible to have, let's say, an uninsured spouse, if someone's been a stay-at-home spouse, so qualify on a spouse's record. Now, normal, regular disability, if I was married and a stay-at-home spouse and without my 40 credits or disability credits, normally wouldn't qualify for Social Security disability or Medicare. But end-stage renal, if I was married, I could qualify my spouse's record. This is the only time that happens. So then the next qualification is they have to have end-stage renal disease, and they have to be undergoing regular dialysis or received a kidney transplant. So then they have to apply for ESRD Medicare. It is an application. Normally the dialysis clinics, when they start dialysis, the social workers at the clinic actually are proactive and go ahead and help the beneficiary apply for this. They normally contact Social Security by phone and schedule a phone appointment. Or if they're not able to schedule a phone appointment, they'll go ahead and complete the CMS 43, which is the application for hospital insurance for individuals with end-stage renal disease, along with a medical evidence report that's required. And they usually fax this into the local office if they're not able to do it by phone. So one of the unique filings with ESRD Medicare is, and it's very rare that this happens, but if someone dies, this is the only time someone could apply for their Medicare after the date of death and get it retroactive. It's very rare that this happens, but it is a policy that can happen. Also, even if Social Security doesn't receive a CMS 43, any inquiry, either verbal or written, is considered a protective filing date for that beneficiary as long as it's within the application's received within 6 months. So if someone had called and said, hey, I'm on dialysis. What do I need to do? That's their protective filing date, as long as they're already on dialysis, so it can get backdated, even if the CMS 43 is not received immediately, as long as it's received within 6 months. So the medical evidence report, this is what the dialysis clinic completes, usually with the CMS 43. It's a form. I will show you. Here's the form. It's a CMS form, and the doctors fill this out. The beneficiary does not have to worry about filling this out. It is a medical form filled out by their medical provider, and they're used to filling these out. It's what they do on a regular basis because everybody at their clinic wants to apply for Medicare. They want them to apply for Medicare so they can get paid. So this is what the clinic fills out and attaches with the CMS 43. So the month of entitlement. When does someone's Medicare begin if they're on dialysis? It begins the 3rd month after the month of the dialysis beginning, so month 4. Or it could begin the month the dialysis begins if before the qualifying period would have ended, the individual begins a self-dialysis training program in a renal Medicare approved center, has completed or expected to complete the program, and can reasonably be expected to self-dialyze after the training. The qualifying period may be waived in cases of appropriate self-dialysis training, or the month that dialysis is resumed following a previous terminated period. They don't have to have a new qualifying period, so they don't have to wait 4 months again. So if someone was on dialysis and they stopped, there's a 12-month cessation for termination, and then they want to requalify, they don't have to wait those 4 months again. The month of the kidney transplant surgery would start, or the month a decision of transplant surgery is made, provided the individual is in an inpatient in a renal Medicare approved hospital when this decision is made, and surgery is performed no later than 2 months after the month of that decision, or 2 months prior to the month of transplant surgery is when the ESRD Medicare can begin. The termination of ESRD Medicare is 12 months after the last month of dialysis, or 36 months after the month of transplant for a kidney transplant. So Medicare beneficiaries usually seek out an insurance agent because the cost of dialysis is quite daunting. It can range from $250 to $350 per session, and they usually get 3 sessions a week. So, Medicare Part A, it's a 0 premium because they're insured for it. You cannot purchase Medicare Part A under the age of 65. So it's the only way they can have Medicare Part A is if they are insured for it. Now, I'm just going to pick the first one right here and go details. I did put a couple of the different medications on. So we're going to look at the drug cost. So you see how some of them are not on formulary and then some of them are. So CellCept generic is the mycophenolate mofet right here. The CellCept might not be on formulary, but there's a generic that is on formulary, and it's much more reasonable. It's a fraction of the cost. You see, it's crazy how medications change so much, right? And then the Prograph. Let's go look at the Prograph. Prograph is the tacrolimus. So let's go into here. Go back to plans. I'm gonna edit this, and I'm gonna add a medication. What was it? TCRO. TCRO. Here we go. And I don't know the dosage. So I'm just gonna say let's say pharmacy. All right. So we're gonna go details again, drug cost, and you see again, it's tier 4, but it's still very reasonable. So we went from not on formulary to using the generics, and the generics are both on formulary. So then we're not medical doctors. We cannot tell them that they have to take those drugs. You merely say, hey, these drugs are the alternate generics. You want to talk to your doctor and see if it's suitable for you to have those instead of the brand name. So those are just some considerations for when you're doing their Part D, is you're going to run into the drug may not be on formulary, and you're going to see if there's an alternate generic that is on formulary. So those are some of the tips I wanted to share with you guys. If it was me, if I was on ESRD dialysis, I would probably want the best insurance that gave me the least headaches, especially if I could get the Kidney Foundation or another program to pay for my monthly premium and my Part B premium and everything. So you can still be the agent of record, and they can pretty much get a med sup paid for by the grant. And so I would always offer to see if they qualify for a med sup in the states that allow it under 65 first, before just putting them in an advantage plan, which might restrict their access to the doctors and facilities that they want to seek treatment at. So just some special considerations, but always go back and see first if they even qualify for the other programs, SSDI, Medicare Savings Program, VA, Medicaid waiver. And you might help them apply for a Medicaid waiver. And some states take a couple months to get approved. So they might get approved for a Medicaid waiver after you help them get a Medicare supplement. And then many times you can, when with Medicaid, you can suspend a Medicare supplement for a couple years if they have full Medicaid, right? So these are some considerations that we want to be careful with, and not just say, hey, I got a great PPO for you, because sometimes that PPO might not be the most suitable, especially if someone needs to go out of state to an out of state facility, right? Or if their facility of choice doesn't take that carrier or Medicare Advantage plans, right? All right, guys, I hope this was helpful. I hope you have a great rest of your day, and we will see you back next time. Bye.
That's a wrap. If this helped you close more deals, hit follow. New agent training drops every week only on Top Flight Insurance.